Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Amir specialist today by calling 855-433-5633 or visiting Amir.com. Learn how you can get the relief necessary to start living your life again.
Well, joining us on the program now are our good friends from Amir, and they're located real close to us. And joining us now is Dr. Rahimi and Dr. Fedi Elias. Thanks so much for joining us today.
Thank you for having us. It's always a pleasure.
It's always good to see you. Tell us a little bit about your practice, and this is something different. Describe non-surgical regenerative treatments, because that's kind of new. It's at least new to me. It's something different.
Sure. So Amir is a medical company that's focused on providing a very personalized and individualized healthcare to patients who are suffering from any type of muscle or joint injury. And through our non-surgical regenerative treatments, we hope that the patients get better and achieve their goals without necessarily having the need for surgery. And so our regenerative treatments, there are a wide variety of approaches to treating these musculoskeletal disorders. And some of them have really failed to effectively alleviate pain, to improve function, or even, let's say, to slow the progression of osteoarthritis. And as a result, these biological therapies or regenerative treatments have become quite popular. And these include PRP, which is platelet-rich plasma, or stem cell therapy. And the proposed mechanism by which they work is to increase the concentration of growth factors to the damaged tissue, and this helps mediate healing and promote the remodeling process.
Right. Do you find the patients that come to see you, are they people that have already gone through a surgical procedure and didn't get any relief, or are they looking for alternatives to that surgical procedure?
Some of them have had some type of surgery before and didn't get relief, and others really just don't want to go under the knife.
Right.
And so this is just an alternative to surgery.
Right. And the interesting thing is when you talk to a doctor, I mean, their purpose, unfortunately, sometimes is to, fix it, through traditional policies or procedures, and they don't look at these kind of new procedures that you're kind of looking forward to.
Yeah, this is very cutting edge stuff. By the year 2030, it's proposed that the need for total knee replacements is to increase almost 700%. And so the medical community at the frontiers of medicine are looking at different alternatives.
So how different is your practice when someone walks into your clinic? Is it different from another surgical clinic that they might visit? What makes it unique?
Well, we hope when they walk in, they feel very welcomed, and then they see a medical practitioner at that time, and we hone in on finding the accurate diagnosis through a very thorough physical exam, history taking, probable x-rays, and we decide if they're a candidate for these regenerative procedures. So if a patient is coming in and we decide that PRP is good for them, they come in and we extract the patient's blood that day. We have the PhD scientist who at that point with specialized medical equipment can separate the platelets from the other active blood products and concentrate the platelets. And this is then injected under image guidance into the damaged area. And so it kind of improves the accuracy of placing the medicine where it needs to go.
Wow.
And we're very fortunate today to have Dr. Elias here with us, and he is truly the expert in stem cell therapy to kind of explain a little bit about stem cells and the appropriate candidates.
Right. Well, Dr. Fedi Elias, you've been with Amir now. Talk to us about stem cell research, and you've heard a lot of it in the press, especially even on Wall Street. Tell us a little bit about the history of that and really where it's going in the future.
Absolutely. So stem cells is really emerging as a very cutting-edge, innovative treatment modality. But I do want to say that what we do is adult stem cells. Okay, the controversy really surrounds embryonic stem cells. So when a patient comes to us for this type of treatment, they've usually done their research. They know what they are looking to do. And let me explain the process. They come to us usually having either seeked treatment elsewhere, had surgery elsewhere, or they don't want surgery at all. And the type of candidate that comes to us usually has meniscal tear, arthritis, those types of injuries, tendinitis, rotator cuff tear, those types of things.
Right. And especially for our demographic, as you age, obviously, whether you're working out in the yard or you are a professional athlete, all of us have, aches and pains, and it's just a matter of, what is the right treatment for, for us? Is it something like this, which I think is a great idea. So why are regenerative treatments, getting this kind of momentum, and why are we hearing about stem cell research so much nowadays?
Well, there's been a lot of research done on it. Also, athletes have made it popular. A lot of big name athletes have sought this treatment elsewhere, have had good success, and that makes it its way into the news, and that's how I think really the emergence of it has taken off.
Yeah. Now, is it similar to, you hear it with cyclists, especially in the UK and things like that, where they're spinning their blood or taking their blood out and getting new blood. Is it something similar to that without the extreme treatment of that?
So that's a very good question. What they do in the UK and Germany specifically is something called orthokine. Think of that as a glorified PRP. They take the blood and then they actually heat the blood. The idea of heating it is to stimulate a febrile response, or a response of a fever in the body, and therefore you get certain growth factors that are good to relieve pain.
Right.
However, we don't do that here. What we do is harvest the stem cells from the patient's fat, isolate the stem cells, mix that with the PRP, and then inject into the diseased joint or tendon or whatever area of pathology there is.
And that enables you to really focus on the treatment of that ailment instead of, hey, your knee really bothers you and you're basically treating the whole leg, but let's get right down to a specific ailment, and that way you can do that with this specific treatment.
Correct. Very personalized, very focused.
What are the biggest benefits for a treatment like this?
In the right candidate, again, candidate selection, patient selection is very important. But the biggest thing that patients will report is pain relief and the ability to get back to what they enjoy doing: exercise, running, walking. Many times after you have surgery, you will have pain relief, but you can never really get back to what you used to do, like running, for example.
So this will actually get you back on your feet a lot sooner.
Yes.
Yeah, very good. Well, tell us a little bit about your practice. Why should someone choose to see a practice like yours?
So, I mean, in addition to, the day of what it looks like for a stem cell patient is that we have a team of physicians. Not only we have ourselves, Dr. Elias, but we also have a plastic surgeon who does the, liposuction for the adipose tissue that we require. We have a PhD scientist and a laboratory that analyzes and kind of concentrates the stem cells, and we sometimes even have an anesthesiologist where necessary. So we have a very team-focused approach to your care. And Dr. Elias will agree, we have the laboratory that really makes the biggest difference, and a scientist that analyzes the cells. And maybe you could talk about looking and keeping the cells so that we see the efficacy of the...
Absolutely. So I think we're very fortunate and very unique to have our own on-site laboratory staffed full-time by a PhD who specializes in adult stem cell research. So part of our protocol, because we want to see efficacy, meaning we want to really analyze when one patient has a good outcome and one patient doesn't have a good outcome with the stem cell treatment, we want to be able to go back and look at the cells and ask, why did this patient have a better outcome versus this patient? So we actually do not re-inject all of the cells back into the patient. We keep a portion of that in the lab so that our PhD scientist actually analyzes the cells under the microscope. These cells are never used again on the patient, strictly for data collection and research purposes for us. And we've proven by doing that, we're able to fine-tune our methods and yield a better stem cell extraction.
Now, when someone comes into the office and they have, say, a lot of joint pain in the knee, which is everybody suffers from that. So is that where you sit down and you talk to them and we figure out what the problem is, what the best treatment is, and then within, is it weeks or months that they're actually treated?
So sure, there are other things that we can try first. We want to try some of the other, less invasive procedures. And if they haven't worked, then we they're candidate for the PRP or stem cells.
Right.
And so we do, like I mentioned before, a thorough physical exam, history taking. We look at their past medical history. Dr. Elias mentioned that we pick the ideal candidate. And we really partner with the patients in their success. We want them to be successful. We've developed this protocol. We redefine it constantly. Dr. Elias himself is an avid runner. He may require stem cell injections in the future. We just need to fatten him up a little bit,
Yeah.
but for the adipose tissues. But yeah, we just really are excited when our patients do better.
Right.
And so I think that's the difference that you have with Amir, not only team-oriented approach, but we truly care about our patients and their success. And we urge you to come in for an appointment to see if you're a candidate for these regenerative procedures. And you can find us online at emere.com,
Right.
emere.com. And I think the number flashes on the
There you
screen
go.
too. Yeah.
Yeah, I was looking at your website and I thought it was interesting that you said candidates are from their mid-20s to well into their 80s. So this can help a wide range of people. And like you said, it's adult stem cell research, so it's something different than what you might hear on Wall Street, but it's something that people may benefit from, and so they need to give you a call.
Yes, from the athlete to the geriatric population alike, that he talked about some of those conditions that we treat. So yeah, anyone is welcome.
Very good. Well, thanks so much for joining us on the program today. It was great information. It's something that I've learned too. So regenerative, that's the hardest thing to do, is to say it, is to go by Emere and take a look at their website, emere.com, and be sure and give them a call at 610-1040 if you have any questions, or if you're suffering from pain, or you just want to feel a little bit better in the morning, get out there and walk with your dog and take a nice little jog. Nowadays, give them a call at 610-1040 for all those ailments that you might be suffering from. Well, we'll be back with more of the program right after this.
Thank
Good job.
you.
Thank you. It's interesting.
Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Amir specialist today by calling 855-433-5633 or visiting Amir.com. Learn how you can get the relief necessary to start living your life again.